Okay, so we're going to pick up on this slide talking about some of the internal chambers of the heart. We know that the heart has 4 internal chambers. There's 2 superior atria and 2 inferior ventricles. And these chambers are separated by valves or heart muscle. Now the ventricles don't connect directly. They're separated by heart muscle, which we call the interventricular septum. And the atria don't connect directly. They're separated by heart muscle, we call the interatrial septum. But what this means, though, is that the right atrium is linked up with the right ventricle, and the left atrium is linked up with the left ventricle. And there are specific valves that separate those chambers because when the atria pump blood down into the ventricles, you don't want blood to flow back while the ventricles are contracting. So what prevents backflow of blood from the ventricles into the atria are the atrioventricular valves. So we have the right and left atrioventricular valves. The right atrioventricular valve separates the right ventricle and right atrium. It prevents backflow from the right ventricle into the right atrium. It allows blood then to leave the ventricle through another place. Now, the left atrioventricular valve, also called the bicuspid valve or mitral valve, it prevents backflow of blood from the left ventricle back into the left atrium. That way you don't have blood flowing back towards the lungs when the left ventricle is contracting. And then blood can leave through a different area through the heart. Okay, so the atrioventricular valves prevent that backflow. Tricuspid is the same as the right AV valves or atrioventricular valves. Bicuspid or mitral valve is the same as the left. Then we have the semilunar valves. We have the pulmonary and aortic semilunar valves. Bless you. The pulmonary semilunar valves prevent backflow from the pulmonary trunk back into the right ventricle, and the aortic semilunar valve prevents backflow from the aorta back into the left ventricle. Okay, that's what those semilunar valves do. Now, looking at these valves in situ or in position, what we find that as we can see some of our heart chambers, so we have the right atrium, right ventricle, left atrium, left ventricle. So then this valve here that separates the right atrium from the right ventricle, this is the right atrioventricular valve, also called the tricuspid valve. Now these AV valves are connected to what we call chordae tendineae, and the chordae tendineae attached to what we call papillary muscle. And the function of this papillary muscle and chordae tendineae is to produce tension and allow these valves to stay shut while the ventricles are contracting. And we'll come back to that later. The semilunar valve we can see here. So this is the pulmonary semilunar valve. It prevents backflow of blood from the pulmonary trunk back into the right ventricle here. But what this pulmonary semilunar valve does is it essentially catches blood when it tries to flow back. So if you look at the kind of cusps here, you'll notice how they kind of cup. Well, when blood tries to flow back into the right ventricle, this semilunar valve snaps shut. It kind of catches. And so when it catches, it prevents backflow of blood into the right ventricle. Okay. Now the left ventricle, we can see the left atrioventricular valve, which separates the left atrium from the left ventricle. Left atrioventricular valve is also called the bicuspid or mitral valve. And that prevents backflow of blood from the left ventricle into the left atrium. And what I mean by backflow of blood, you guys, is when the left ventricle is contracting, you don't want blood to flow back to where it came from, right? Because if blood flew back into the left atrium, you're basically kind of forcing it back towards the lungs, and you don't want backflow to the lungs. So this left AV valve or bicuspid or mitral valve prevents that backflow. Over here, kind of tucked up in this corner, you guys, this is the aortic semilunar valve. And this aortic semilunar valve separates the left ventricle from the aorta so that when blood pressure in the aorta is actually higher than blood pressure in the left ventricle, blood might want to try to flow back to where it came from. But what prevents that backflow then is the aortic semilunar valve. So like the pulmonary semilunar valve, it'll catch that blood, it cups it, and it closes it. It actually catches it as these cusps catch the blood and they close. And that prevents backflow of blood from the aorta into the left ventricle. That way you can actually have an efficient amount of blood flow and continually move it on in one direction. Okay. Now it turns out that all these valves, some of these valves can open and close at the same time. So it turns out that the atrioventricular valves both open and close at the same time, and the semilunar valves both open and close at the same time. Because what happens, you guys, is that both atria contract and relax at the same time, and both ventricles contract and relax at the same time, which means that their associated valves have these coordinated events. So when the atrioventricular valves close, they both close at the same time, that produces the first heart sound, which is lub. So it's only the closing of those valves that produces that heart sound. And then when the semilunar valves close, they both close at the same time. And these semilunar valves close with so much force that produces the dub noise in the heartbeat, lub dub. So dub is the closing of those semilunar valves. And they produce such a loud noise, you can hear this audibly, even if you just put your ear up to someone's chest. So it's pretty cool that these valves are that strong. Now, what's interesting then, you guys, is what helps coordinate the events between the atria and ventricles is electrical activity. So it's electrical activity in the atria that allows both atria to contract simultaneously, and it's electrical activity in the ventricles that allows for the ventricles to contract simultaneously. But what's neat, though, is what separates the electrical activities of the atria and ventricles is this fibrous skeleton. So what the fibrous skeleton does, guys, it's actually like a dense, regular type of connective tissue. First of all, it's a place for cardiomyocytes to attach to, so they kind of link up there. But these fibers are not a good conductor, which means they work as a great insulator. And as an insulator, they don't allow electrical currents to flow across that fibrous skeleton. So this fibrous skeleton then prevents electrical activity from going straight from the atria straight into the ventricles. You don't want that to happen. You want the electrical activity to follow a specific pathway. That way, the heart will contract in a more coordinated manner. So what does this fibrous skeleton look like? Well, it's right here, you guys. So this is the fibrous skeleton, and it's also what these valves are attached to. So you can see the fibrous skeleton here. And so we're actually looking at kind of a top-down, top view of the valve. So this is the oblique cut through the heart. If you cut right in the right spot, you see all these valves are actually in the same plane. So what's cool is here's the atrioventricular valves side by side. Here's the semilunar valves side by side. So it turns out that the atrioventricular valves both open and close simultaneously. The semilunar valves both open and close simultaneously. And that relates to the electrical events in the heart. And we'll come back to that. And that also will influence the mechanical events which cause these valves to either open or close. Now, so just to mention, you guys, the fibrous skeleton, remember, was an insulator. So it helps prevent electrical currents from just randomly entering the ventricles and kind of mucking things up. Because you wouldn't want the ventricles to start contracting before the atria were done contracting, right? Because if the atria are still contracting, then the valves are still open. If the ventricles start to contract while the atria are contracting, then you're going to get a backflow of blood. And you don't want that to happen. Nor will the ventricles adequately fill with blood. So what helps prevent electrical currents from just spreading straight down the heart is this fibrous skeleton, which functions as a great insulator. If this fibrous skeleton is damaged, you can start getting odd electrical activities, which can cause arrhythmias, which we'll talk a little bit about today, but mostly in pathophysiology. But arrhythmias just mean abnormal heart rhythms, which can be fatal. Not always, but they can be. If you look at the structure of heart muscle, you'll notice that it's kind of arranged in these odd-looking bands. So the atria kind of form a circumference here. The atrial muscle here forms a circumference around each atrium, right? So you can imagine if this muscle then contracted, it would kind of squeeze on the atria, right? Because it's in a circular pattern. And by squeezing on those atria, you're basically helping to force that blood down in the ventricles. And if you notice that the pattern of muscle along the ventricles kind of spirals around the apex, and that's what we can see here. This is important to note because it's actually the apex muscle that contracts first in terms of ventricle contraction, followed by more superior parts of the ventricles. That way the ventricles can squeeze blood from the apex up and out of the heart, not from the top down, because if the top parts of the ventricles contracted first, you would force blood to the apex of the heart, which means the bottom of your heart would explode. No, I'm just kidding, it wouldn't really, but right, like if the top part of your heart just contracted from the top down, then the blood would be forced towards the apex, and the whole apex would just explode out. It wouldn't really happen that way, but I like to think that it might, because it sounds more dramatic and interesting that way. So here's another view of that spiral arrangement of cardiac muscle, you guys. So you can see that atrial muscle spirals here around the atria. So when the atria contract, they squeeze. When these atria contract, they're going to force that blood down into the ventricles. And when the ventricles contract, they're going to squeeze that blood from the apex up and out, right? And the reason why I have a spiral pattern at the apex here is it kind of helps twist and squeeze that blood up and out of the heart. So what we find that is that blood's pumped from the atria down in the ventricles, so this squeezes first, followed by the ventricle muscle contracting second, but it contracts starting at the apex and then spirals up. That way, the blood's actually pumped up and out of the heart. That way the blood's actually pumped from the right ventricle into the pulmonary trunk or from the left ventricle into the aorta up here. So this shows the spiral arrangement of cardiac muscle. So going through each of the heart chambers, you guys, we're going to talk about what anatomy you find in each of those heart chambers and the significance of each. So we're going to first start with the right atrium. We'll just pick a starting point, right? We'll just say it's the right atrium. So the right atrium is part of the right side of your heart, hence the name right atrium, and it's going to receive venous blood from several different areas. It receives systemic venous blood from the superior and inferior vena cava, and it also receives venous blood from the coronary sinus. So it's the coronary sinus that drains that venous blood from the coronary veins itself back into the right atrium. Now, the right atrium is separated from the right ventricle by the right atrioventricular valve, also called the tricuspid valve. And so it receives this deoxygenated venous blood from different veins. Blood then flows from the right atrium to the right ventricle. From the right ventricle, it gets pumped out through the pulmonary trunk towards the lungs, where that blood then can become oxygenated. Now, the function of this right atrioventricular valve or tricuspid valve is it prevents the backflow of blood from the right ventricle back into the right atrium while the ventricle is contracting, right? Because you can imagine if the ventricle is contracting, it's forcing blood up and out. But if that valve were open, why doesn't blood just flow back into the right atrium? Well, it would. So what we find then is that the right atrioventricular valve will close while the ventricle is contracting. It prevents the backflow of blood in the right atrium, so then blood's only got one exit. And that one exit is through the pulmonary semilunar valve out through the pulmonary trunk, and then that splits into the pulmonary arteries, which carry that deoxygenated blood towards your lungs. And so it works very efficiently this way. And you might wonder, well, what causes these valves to close? It's pressure. So when the ventricle is contracting, blood is being forced up and out of the heart, right? Which actually allows that, it's actually a mechanical force in, so it's the blood that's pushing up on those valves. So the blood pushing up on those valves causes the valves to close. They stay closed because they're anchored to the chordae tendineae, which are connected to papillary muscle. Papillary muscle contracts, it pulls on those chordae tendineae, and it keeps those valves shut, right? Because due to blood flow, you'd imagine the valves would want to keep going and opening up, which then blood can flow back. But what keeps the valve shut then are the chordae tendineae that pull down, and they oppose the upward movement of the blood. Okay, so
blood's pushing up while the chordae tendineae are pulling down.
You got it, and it keeps those valves shut, which is pretty cool. So if there's a problem with those chordae tendineae, then you might get some backflow of blood. So, yeah, good point. So what about the right ventricle? Well, we know it's not connected directly to the left ventricle. Under normal circumstances, they're separated by this interventricular septum. We find papillary muscle in the ventricles, which is connected with the chordae tendineae. And if it's not any papillary muscle in the ventricles, we call it trabeculae carne, which basically just means kind of meat pattern or woven meat pattern there. So papillary muscles here, you guys, are the cone-shaped or nipple-shaped structures you find in the ventricles. I like how your book says cone-shaped, right? As if like we would be too offended if it's a nipple-shaped. I know. Just get the nip-shaped structures in your ventricles, which have the chordae tendineae attached. Those attached to the AV cusps. So each of the cusps of your valve have chordae tendineae attached, and these papillary muscles will contract, pull on these cusps, and that way they can help oppose the upward force of blood, which has a tendency to want to have those valves open up. So these help prevent backflow while the ventricle is contracting. Now, it turns out, you guys, the right ventricle is associated with this thing called conus arteriosus, which is a little smooth area just before the pulmonary semilunar valve. Now, the pulmonary semilunar valve is what separates the right ventricle from the pulmonary trunk, and this prevents backflow of blood from the pulmonary trunk back into the right ventricle. You wouldn't want that to happen, and it could happen if you didn't have this pulmonary semilunar valve functioning normally. Now, we know then that the pulmonary trunk branches into the pulmonary arteries. It carries blood to the lungs. The lungs oxygenate that blood. We'll talk about that later. But then that blood returns back to the heart through the pulmonary veins. Nice. Then the pulmonary veins drain into the left atrium. The left atrium is separated from the left ventricle by the left atrioventricular valve. While the atria is filling with blood, this left atrioventricular valve is actually open. So that blood's not only just filling the atrium, it's also spilling into the left ventricle, okay, because this valve's open. But this left atrioventricular valve, also called the bicuspid or mitral valve, It's called a mitral valve because mitral means pertaining to the mitres hat, which is like the Pope's hat. So it looks like a Pope's hat. It has these two triangular cusps, hence the name bicuspid as well. And this is actually going to be force closed when the left ventricle contracts. But here's what's important to note, you guys, is that the right ventricle and the left ventricle contract simultaneously. It's not as though the right ventricle contracts first and then the left ventricle contracts. They contract at the same time, which means then that both atrioventricular valves close at the same time, and they close in the same manner. Just like the right atrioventricular valve, the left AV valve, or bicuspid valve, it closes when blood's being pushed up on the valve. When the ventricle's contracting, it's going to force blood up on the valve snaps shut, and what prevents the valve from going any farther is the chordae tendineae that it's anchored to, which is connected to the papillary muscle. So that means that both atrioventricular valves close simultaneously, and that produces the first heart sound, S1, which is the lub noise. So lub is when both AV valves close simultaneously. Yes?
Are there papillary muscles in the ventricle?
I missed that. I'm sorry. What did you say?
Are there papillary muscles in both ventricles anchoring the chordae tendineae?
There are. Yeah. Yeah. So there is papillary muscle in both ventricles. So the left ventricle, you guys, it has it has to pump blood to the rest of your body, which means it needs to produce a tremendous amount of force. So it's actually 3 times thicker than the right ventricle, and under normal circumstances. And because the muscle is much thicker, it produces a lot of force, and it can actually help pump that blood to the rest of your body. Because we know the left side of your heart's part of your systemic circuit. Okay. Now, at the superior end of the left ventricle, we find our aortic semilunar valve, and that's where blood actually can leave the left ventricle. You know, when the left AV valve snaps shut, that blood can still leave the left ventricle, but it leaves through the aortic semilunar valve, which then allows that blood to enter the aorta. But while the ventricle is relaxing and pressure in the ventricle starts to decrease, you're going to find a circumstance then when pressure in the aorta exceeds pressure in the left ventricle. And when that happens, blood wants to flow back into the left ventricle. Because remember, blood flows from high to low pressure. So when pressure in the left ventricle is lower than aortic pressure, blood will want to flow back. But that wouldn't be a very efficient way to keep blood moving in one direction. So what prevents that backflow of blood then is the aortic semilunar valve here. So our aortic semilunar valve prevents backflow of blood from the aorta back into the left ventricle during ventricular diastole or relaxation. Okay, and when this aortic semilunar valve closes, that produces S2, which is the second heart sound or dub noise in lub dub. Right? In fact, it's not just the aortic semilunar valve that closes here; it's also the pulmonary semilunar valve. Good. So both semilunar valves close simultaneously because both ventricles relax simultaneously, which means that pressure decreases in both ventricles at the same time, which means blood in the pulmonary trunk and blood in the aorta both want to flow back to where they came from at the same time, which causes these semilunar valves to close simultaneously. And knowing that, you guys, knowing that these are simultaneous events, it makes the cardiac cycle later easier. Once you start realizing it's not like the right atrium contracts followed by the right ventricle, then the left atrium contracts followed by the left ventricle. It's not 1, 2, 3, 4. It's both atria contract simultaneously, both ventricles contract simultaneously. And that leads to what we call the cardiac cycle. And we'll get to this more so later. But that's coordinated by electrical events that we'll talk about too. We know the heart receives a tremendous amount of blood flow from coronary vessels because the heart is actually beating pretty consistently. So we have the right and left coronary arteries. Where do these emerge from?
Aorta.
You got it, aorta. So the right and left coronary arteries come right off of the aorta. They supply blood to the heart itself. The left coronary artery branches into the... It goes to the left ventricle, but it gets there through the... I'll show you guys a picture. Okay. So here's the left coronary artery. So yeah, so we got the left anterior descending, or the anterior interventricular artery, right? And also the circumflex artery, which wraps around the heart. Okay, those are branches of the left coronary artery. If you look at this, you can see that it supplies a majority of the left side of the heart with blood. So if someone had a blockage in the left coronary artery, you can imagine then that left heart structures would be affected. Okay. Yeah, left anterior descending or the anterior interventricular artery. Over here, we have the right coronary artery coming right off the aorta. It branches into right marginal, which supplies blood to the right ventricle, but it also continues around, wraps around the backside of the heart, and then it branches into the posterior interventricular artery, or right posterior descending. And then these two arteries, the anterior interventricular artery and posterior interventricular artery, connect at the apex. Now, normally, these connections are very minor. Like the anastomosis here is very, very minute. But if you have more of a chronic blockage in either vessel, the other vessel can grow larger vessels to the other side of the heart to accommodate for that blockage. Like let's say if someone gets some plaque that builds up in their left anterior descending here, and it's more of a chronic buildup of a plaque, that means that chronically you have diminished blood flow downstream of that blockage. Well, the right posterior descending or posterior interventricular artery can actually grow around and then supply blood to the left side of the heart, which is actually pretty cool. So there's some modifiability here. You know, the anatomy that we have or we're born with isn't necessarily always what we have for our whole life. Like our bodies can change to accommodate changes in our internal state, which is actually pretty cool. So what this means is if you have a heart attack, you can grow new vessels around that blockage. So it's not always like, you know, the end of your heart from one heart attack. You know, there's some recuperation of function later on. But what's important to note, and we might not talk about this a lot today, you guys, is that cardiac muscle doesn't really regenerate very well. So if someone does have a heart attack and then they get death of the cardiac muscle, you won't get a lot of new cardiac muscle that regrows.
So once it's dead, it's dead. But if you can prevent it from dying with blood flow, then you can save it.
You got it. So once that cardiac muscle is dead, you know, the cells basically become necrotic, they burst open, you don't really grow a whole lot of new cardiac muscle cells back into that dead tissue. Now, there are some potential stem cell therapies, you know, that's sort of on the pipeline, but you can prevent that cell death if you can increase blood flow. What's important to note here, though, you guys, is you can't grow vessels fast enough. If you have a more of an acute blockage, you won't be able to grow new vessels to get around that acute blockage. You know, that takes more time. So if it's an acute blockage, that you're talking about acute care, right? So if someone goes to the ICU, they have a stent put in, or a coronary bypass, or even thrombolysis, where you can go in with like some enzymes or even a device they can use to break apart that blood clot. So we'll talk about that more so in pathophysiology, though. So in terms of the venous system, you guys, there's three main cardiac veins. So all of these arteries here, they eventually lead up to capillary beds, which you find in the muscle, but then those converge in these veins. The great cardiac vein is paired with the anterior interventricular artery. The middle cardiac vein is paired with the posterior interventricular artery. And the small cardiac vein is paired with the marginal artery, which you can see here. So here's great cardiac vein. It's going to carry blood back towards coronary sinus. Here's the small cardiac vein. It's going to carry blood also back towards the coronary sinus. And here's the middle cardiac vein on the posterior side of the heart. And they all drain blood into a coronary sinus. Now, a sinus is just a large space in your body. You know, there's the paranasal sinuses in your cranial bones, there's your facial bones. We have blood sinuses in our spleen and liver, but we also have a coronary sinus on the back side of our heart here. It's where all of this venous blood drains into, but then this coronary sinus, you can see this little opening here, it also drains that blood back into the right atrium. So the right atrium not only receives deoxygenated venous blood from the superior and inferior vena cava, but it also receives that blood from coronary sinus. So it's kind of interesting. So what this slide shows you guys is a really nice summary of blood flow through the heart. I want you guys to know this pattern of flow. But what's also important to note from this picture is that, remember, these things are occurring at the same time. It's not like that it's only like step 1, step 2, step 3, 4, 5. You know, blood's flowing through this whole circuit at the same time, right? It's not like blood over here is not flowing while blood over here is flowing. It's all flowing simultaneously because both atria are contracting and both ventricles are contracting at the same time. So we just got to pick a starting point. Let's just pick the right atrium. So where does the right atrium receive blood from? Good. And what's missing on this slide? So not just superior and inferior vena cava, but one more place. Nice. Coronary sinus. So we could make this better. We could add on this, say, coronary sinus also drains into the right atrium, right? Then the right atrium would pump blood into the right ventricle. There's a valve that separates the two.
Right atrioventricular.
Right atrioventricular valve, or the tricuspid valve. When the right ventricle contracts, this valve closes. You're not going to see a backflow of blood. Instead, when the right ventricle contracts, blood's going to flow through the pulmonary semilunar valve into the pulmonary trunk. From the pulmonary trunk, that splits into two pulmonary arteries. You got the right and left pulmonary arteries, which carry blood to the lungs. It's deoxygenated blood. You get some gas exchange in the lungs. Then that oxygenated blood from the lungs comes back to the heart through the pulmonary veins. Good. Pulmonary veins drain into the left atrium. Very good. In the left atrium, when that contracts, pumps blood into the left ventricle. Now, does the left atrium contract solely by itself? No. At the same time, the right atrium is contracting. So the right atrium and left atrium contract simultaneously. So you can somehow connect these two. In time, these would both contract at the same time. So they're keeping blood flowing at the same time. Okay. So when the left atrium contracts, it's going to force blood through the left atrioventricular valve, aka mitral valve or the bicuspid, into the left ventricle. Now, when the left ventricle contracts, it also doesn't contract solely, right? What contracts at the same time?
The right ventricle.
You got it. So the right ventricle contracts at the same time. So these are also linked up in time. So the right and left ventricles contract simultaneously. When the left ventricle contracts, it pumps blood through the aortic semilunar valve into the aorta. What happens when the left ventricle relaxes? Good. And the aortic semilunar valve shuts because once the left ventricle relaxes, you find that pressure in the aorta is actually higher, not lower. And we know that blood only flows from high to low pressure. So if pressure in the left ventricle is lower, blood wants to flow this way. But you notice these arrows only go in one direction. Blood doesn't normally flow back. So when the left ventricle starts relaxing, this aortic semilunar valve closes, and it prevents the backflow of blood from the aorta back into the left ventricle. Now, I'll ask you guys this one too. Does the left ventricle relax on its own? No. The right ventricle also relaxes simultaneously, right? So that means while the left and right ventricles are relaxing, blood from the pulmonary trunk could also potentially flow back into the right ventricle because pressure is now higher in the pulmonary trunk than the right ventricle while it's relaxing. So, exactly. But what prevents the backflow of blood then is these valves shut. Now, it's not as though the valve doesn't know that pressure is higher or lower. What allows these semilunar valves to shut is the slight backflow of blood.
Yeah.
And it's the flow of blood back that closes the valves. Like the valves don't know when there's pressures higher or lower. They only close to changes in blood flow. So when the blood wants to flow back into the right ventricle or left ventricle, the semilunar valve gets snapped shut by the blood forcing down that valve.
So they're kind of like swinging doors.
Yeah.
Except they only go
One way.
direction.
You got it. And I had the experience recently. There's a Persian market nearby called Arash, and they've got awesome food here, guys. I would highly recommend it. The hummus is awesome. I got this eggplant salsa. It was super bomb. Really good pita with really good pita with thyme and tarragon on it with some olive oil. Ridiculous. So, anyways, they have those doors there. You can only go one way. So they open up in one direction when you come nearby, and if you try to walk back, they close behind you. So you can only go through the doors one way. And in that sense, those one-way doors function like the one-way valves of your heart. So when blood pushes through the valve might open in a particular direction. And if blood tries to flow back, the valves close due to the backflow of that blood. But it's not as though blood's actually getting to its place. It's just that the blood flowing back causes the valves to snap shut. Now, we'll go into more detail on this later, you guys. This isn't really the part where I typically talk about valves closing, that kind of stuff. But when we see pictures, it kind of is more clear. But for now, know that the direction of these arrows is dictated by two things. Pressure differences, because blood only flows from high to low pressure, but we know that pressure changes occur in the heart. So that pressure can't be the end of the story. Pressure does allow for blood to only flow from high to low, right? But what about when the heart's relaxing and now pressure's lower in the heart than like other vessels? Well, what prevents that backflow are the valves. You got it. Sweet. So then after the aorta, you guys, where does that blood flow? To the body, systemic arteries. And we'll learn about those arteries next week, like more of the anatomy. Those systemic arteries lead into systemic capillary beds. Capillary beds are where gases and nutrients and wastes can be exchanged. It could be like a capillary bed in your brain, in your liver, in your muscles of your thigh, anywhere. Now, what's that? Now, except for the lungs, though, right? The lungs don't receive blood from the aorta. Well, they do, but they don't. And we'll get to more of this anatomy later. But most of that blood flow to the lungs comes from the pulmonary arteries, which are back here, right? So systemic capillary beds then will basically help to deliver oxygen to your body's tissues. That means the blood that's flowing back towards your heart through systemic veins is deoxygenated blood. And these veins carry blood back to the heart, and the whole process repeats, you guys.
Except this is really fast.
It's really fast. You're talking about lub-dub, right? That's one cardiac cycle. And there's a short period of time after the lub-dub that's still part of that cardiac cycle. But between beats, right? Let's say if your heart rate at the moment is 75 beats per minute. Between each beat is still less than a second. And so that all of this is occurring in fractions of a second. And that, to me, is one of the most amazing things about the heart.